Well, for me, one of the things that I found when I was doing general practice, that I've also got a family, and at that stage they were a bit younger, and you would come home after a very hectic day of general practice, a bit frazzled often and rushing and often late to the childcare pickup and that sort of thing, and then you'd be busy at home. The difference is with enough time to do a proper skin check and enough time to perform an aesthetic medicine consultation, you just don't have that constant rushing and that constant feeling of always being, always running late and always having to apologise for keeping patients waiting. It's much easier to run to time, and you don't have those sort of stresses when you're doing some of these other things. A lot of it is about time management, so we make sure that we allow enough time with our patients to be able to discuss everything that we need to discuss with them. When you're incorporating aesthetic medicine into the clinic environment, whether it's general practice or skin cancer, it's often good to have separate consulting times so that your aesthetic patients are not necessarily mixing in the waiting room with patients who are unwell. The difference is an unwell patient unfortunately has no choice. They'll have to wait to see the doctor because they're sick and they might need treatment. But an aesthetic patient, unfortunately, the consultation is a bit more of a business transaction sometimes, and they're not prepared to wait. So you need to make sure that you're not having a general practice session where you're busy and you're running late and you're keeping a patient waiting for 45 minutes, because they usually won't tolerate that.